Between 1990 and 2015, we've had dramatic decreases in deaths of children under the age of 5. The problem, on the other hand, is that of those who survive, over 250 million don't realize their full potential. The best period to be able to address developmental milestones, early childhood development, ECD, is through the health sector in the first 3 years of life. Whether it be interactive, nurturing play, whether it be utilizing low-cost, locally made materials to develop toys, whether it involves responsive care actions and talking and interacting and touching and massaging the babies and the children, this is all the work we're doing.
We are training the health workers to integrate early childhood into their routine services. When children are brought in for growth monitoring, then the health worker can share a key message around care and stimulation or around nutrition.
The nurses that have been trained in this, it's changed the way they're interacting with the children, and it's changed the way that the children are perceiving these health workers. They're not as afraid of these health workers. We've been trying to make the health facilities more mother and child friendly. We have play boxes or play spaces, and the idea is for the parent to interact with the child and use those play materials to stimulate the child.
At the household level, we are working with community health workers.
Christine, kane pok wadhi ire, nyathine weak, nyathi ok tugi, nyathine osika sika ojung' ajung'a.
Kane Nyamreche obiro mopuonjowa about ECD kata kaka inyalo rito nyathi.
Sani nyathi chiemo maber, miyudo kata kowe oringo gi jowadgi, mano ok notim before.
Ngimane lokre, yani ngimane bedo maber.
Like in Kenya, you can see we are in a pilot state. We have taken about 7 counties where we want to pilot care for child development.
We are working with healthcare workers who are already trained by government. So ECD is fitting in at no extra cost.
The approach to go is integration so that it is not dependent on donor funds.
The idea is how do you work with government and strengthen government systems so that they take on and continue the work that we were introducing or what we're supporting.
We want it to be mainstream and integrated in existing programs.
Before ECD was introduced, we were saying like they're adding us more. There's no much work in ECD. It spices up our services.
This is a great time for early childhood development. We've got the Sustainable Development Goals that have identified early childhood development as a major milestone.
Investment in ECD has long-term outcomes. There's better income generation in the long term. There's better social outcomes. There's children that are less violent, sort of better members of society in the long term.
I think the time is now. Address the early years, change the early years, you change everything else.